Hello, this is Dr. Kim Jeong-gil. From today, we will look at denture pattern analysis. The important thing in density pattern analysis is the analysis of the occlusal plane. Today is an introduction to the occlusal plane. The occlusal plane is a line connecting the upper and lower occlusal points. We know that the occlusal plane is of great importance, not only in orthodontic treatment, but also in prosthetic treatment. In fact, we think that it is unconditionally difficult, if only the story of the occlusal plane comes out during orthodontic treatment. However, when we develop orthodontic diagnosis and treatment plans, we use a variety of baselines, of which the occlusal plane occupies a very important place in the process of cephalometrics and treatment. The occlusal plane is a line connecting two points, mainly connecting points in the anterior and posterior parts. There are many occlusal planes used in orthodontic and prosthetic applications. Gnathologic occlusal planes, upper occlusal plane, functional occlusal plane, bisected occlusal plane, anterior occlusal plane, posterior occlusal plane, and so on. Gnathologic occlusal planes are prosthetic occlusal planes and are often used for restoration or wax-up of prostheses. Occlusal plane used at this time is based on the mandible. It is the line connecting the incisor tip of the mandibular incisor to the distabecal cusps of the mandibular first molar. Take this line as a reference and do wax up. Next up is the upper occlusal plane. Upper occlusal plane is the line connecting the mesobuccal cusp of maxillary first molar at the incisal edge of the maxillary central incisor. The upper occlusal plane is important for forming the maxillary occlusal rim of the total denture of the prosthesis. It is said that the Camper's line, the line connecting alar and the tragus, and the line connecting the occlusal plane of the maxilla, must match like this. Gnathologic occlusal planes and upper occlusal planes were used a lot for prosthetics. So, which occlusal plane is mainly used for orthodontics? Functional occlusal plane is commonly used. Functional occlusal plane is the line connecting the mesobuccal cusp of the mandibular first molars and the cusp tip of the mandibular first premolar. This occlusal plane is also known as the chewing plane. Functional occlusal plane in normal occlusion is said to pass through the C point in the posterior and slightly below the lip embouchure in the anterior part. Next, the occlusal plane that is frequently used in orthodontics is the bisected occlusal plane. Bisected occlusal plane is a line connecting the midpoint of the upper and lower incisors overlap and the midpoint of the distabecal cusp of the upper and lower first molars. Professor Kim mainly used bisected occlusal plane. Bisected occlusal plane is also called Downs occlusal plane. It is said to be 1.5 mm below the lip line at the front and 90 degrees to the AB plane at the rear, and the rear part is generally evaluated as the first molar level. Usually, orthodontic patients have malocclusion. In the photo, the blue line is the bisected occlusal plane, and the red line is the functional occlusal plane. You can observe that the two lines do not match. According to Burstone's comments on the occlusal plane, for the aesthetic plane of occlusion, the maxillary incisors should be located 3 mm below the upper lip in a relaxed state, and the line connecting the distabecal cusp of maxillary first molar was called the aesthetic plane of occlusion. In addition, Burstone evaluated the occlusal plane by dividing the occlusal plane of the maxilla and mandible into the occlusal plane after treatment. When determining the occlusal plane, he mentioned how the distribution of natural occlusion plane, aesthetic occlusion plane, and alveolar processes and the anteroposterior relationship are related to the occlusal plane. First is the natural plane of occlusion. In general, it was said that in occlusion the lower occlusal plane should be located 2 mm above the upper occlusal plane, and that the occlusal planes of the maxilla and mandible are almost parallel. In addition, Burstone said that axial inclinations of individual teeth are very important for the natural plane of occlusion, and that these axial inclinations affect the safety after treatment. Therefore, it was mentioned that it is desirable to minimize axial inclinations after treatment. The second is the aesthetic plane of occlusion. When the aesthetic plane of occlusion and the natural plane of occlusion do not match, you need to decide which occlusal plane to treat. Third, we mentioned how much the alveolar process occupies when forming the occlusal plane. Baselines are in S and Menton. It was noted that the distance between the incisor edge of the mandible and the menton generally accounts for 0.61%. It was also said that the anteroposterior relationship affects the occlusal plane. In other words, Burstone noted that the anteroposterior relationship can be determined depending on whether the occlusal plane is flat or steep. Therefore, he said that the treatment plane of occlusion should not be determined artificially, but should be customized to the individual patient, and should be determined in a direction that is beneficial to the patient. So how do you decide? At this time, many factors were said to have an effect. He said that patients should select a device in consideration of the mesial inclination of the posterior teeth, treatment stability, aesthetics, periodontal status, anteroposterior relationship, and treatment limitations, and treat them while looking at patient cooperation. However, there was no mention of any specific method. Let's review the occlusal plane used in orthodontics. Generally, CEF is used, such as Downes analysis, Steiner's analysis, Witt's analysis, Sassonis analysis, COGS analysis, and proportional analysis. For these various occlusal planes, Downes' occlusal plane was first mentioned. The baseline for Downes analysis is the FH plane. The angle between midpoints of the central incisors and of the first molar makes the FH plane. On average, 9.3 degrees is normal. The baseline for Steiner analysis is the SN plane. At this time, the average value calculated based on the SN plane is 14.5 degrees. Witts took the functional occlusal plane as a baseline when evaluating the anteroposterior skeletal relationship between the maxilla and mandible. This functional occlusal plane has already been taught, and it is a line that connects the cusps of the mandibular first molar and the first premolar. Sassonis analysis said that the line connecting the midpoints of the upper and lower incisors and of the posterior tooth is the upper occlusal plane, and the angle that this line forms with the mandibular plane is the lower occlusal plane. Burstone also evaluated the occlusal plane. Burstone held the true horizontal plane as a reference and measured the maxillary occlusal plane and the mandibular occlusal plane. Koski et al. evaluated the occlusal plane in percentages by evaluating it using proportional analysis. When evaluating these kinds of occlusal planes, mainly the anterior part or only one plane is evaluated. So, can we properly assess the state of dental occlusion we want? Therefore, MEAW analysis uses occlusal plane analysis to overcome these limitations. This will be taught in detail again in Part 2. Thank you for watching.